Hey everybody, it's me, Dr. Cameron Dennis. I'm a physical therapist in Lima, Ohio, and I own my own physical therapy practice called Back on Track Therapy and Wellness. And so I like to get on here and try to teach a little bit about what I've learned over my 10 years in practice. And today I want to talk about five physical therapy myths that you need to stop believing. And these are commonly held beliefs that we run into all the time. People are always asking certain questions. And so I wanted to go through and really put some of these to rest. So hopefully you'll learn something from this and have a different perspective on what physical therapy actually is by the time I'm finished. So the first one is PT or physical therapy is like personal training. Um, Physical therapy is more focused on the functional performance of the client or the patient, as opposed to the personal training, which is going to be more focused on weight loss or just building general strength and wellness. It's not that that you can't focus on building strength in physical therapy. As a matter of fact, that's a big part of what we do. But I think that's more of the means to the end. It's more of how we get to the higher level of function. Because what we do is we do the evaluation on the first session and we say, okay, what types of things, what types of activities each day are you struggling to do? Or are you having pain with those things? Because pain is another one of and this is up for debate, but it's something that we do often work with people on, and especially if it's something that if they're having pain that's limiting them from doing a particular functional task, like sorry, like carrying in groceries or doing stairs, walking, standing, sitting. You get the idea. It's much more function based. And personal training is much more based on building strength, looking good, those types of things. And so I'm being very general here, but those to me are the biggest differences. The other interesting thing to think about is that um, there are, of course, good and bad of both PTs and personal trainers. Um, and so it's not to say that more education is always a better thing, but I think it needs to be said that the physical therapy is a doctorate versus personal training, which is more, generally speaking, it's a certification. And so, that might take anywhere from a weekend course to, a year to study for it. But at the end of the day, it really is just one certification test in most cases, as opposed to 7 to 8 year doctorate um, education through a college. So, and it's not to say that, there aren't personal trainers who perform at a higher level, who do a lot of continuing education and things like that to level up and increase their performance. It's just, across the board, that's kind of where we start, and those are the major differences that I see. Um, as well as personal training is typically done in a gym, and physical therapy generally is either in a clinic or in your home or in a hospital, nursing home, things like that. So that's the first myth. So the second myth is PT is always painful. I literally have people that will ask, um, or that will call it pain and torture, or they'll say you're my personal terrorist or something along those lines. And then of course, we laugh and they're funny. Um, but our goal really is to reduce pain as much as possible during the session. And so if you come in and you're having a lot of pain, if we can, our objective is to avoid things that make that pain worse during the session, have you avoid those things, generally speaking, when you go home. Because doing things that aggravate your pain tend to uh, cause recovery to take a little bit longer, just in general. So, like, say you have sciatic nerve pain and you're doing things that irritate it, that there's a good chance that that's making the problem worse and that it's taking your recovery time in making it longer. And now there are things that might be a little bit uncomfortable, like exercise. Some people love exercise, and some people think, they'd rather die than do squats. I hear that every day. Or, any physical therapist really hears that, those types of things. But at the end of the day, our bodies are built to move, and we try to get you moving to the best of our abilities, moving your body in ways that feel good, or at the very least don't feel bad. So that's my thoughts on the myth that PT is always painful. Generally speaking, we want you to feel better, and we're going to avoid things that are painful, unless we need to push through a little bit of discomfort to get to an end goal, like a stretch or like a certain manual technique where there's a lot of pressure or something like that. But for example, like after a knee replacement, stretching that knee to make sure that you're able to use it, that might be a little bit uncomfortable, but um, that's short-lived, and that will allow you to be able to walk and use that knee functionally. And really it only lasts, a couple of weeks to a month or so coming in doing that. But then doing it on your own makes it less painful when you come in here and do it too. So but yeah, so our main goal is to not have it be painful. So no reason to avoid coming to PT because you think it's going to hurt. Okay. So myth number three, PT is only for injuries or after surgery. I think this is actually a really common one. I see this one a lot, because you have this view, at least in this area, of people who feel that if you're having pain, that you see a chiropractor. If you're after a surgery, or if you had an injury, like you fell down the stairs, you broke your arm, um, and you need to have rehab, then they think that's what physical therapy is for. And while that is what physical therapy is for, it's for a lot of other things too. Um, PT is not only for injuries or surgery. It can be done to help with chronic pain. So like back pain, neck pain, shoulder pain, tennis elbow, you name it. I mean, if it's musculoskeletal or neurologic in nature, there's a good chance that physical therapy can help reduce your pain. So reducing stiffness. So a lot of times that's due to weakness or overuse. And so doing some strength training or some type of movements, maybe some dry needling or hands-on therapy, a lot of times will help with stiffness. Improving balance, so we'll do balance training. We'll treat vertigo and dizziness. Um, we will work to improve your daily function. So if you're having trouble hiking, there's things that we can do to help you be able to do that. Or if you're having difficulty getting up and down stairs or carrying the groceries in, be whether it's be because of pain or just, weakness. Sometimes you just don't use it, so you lose it. And so we build your strength, we build up your function. We can help with pain, dizziness, vertigo. I mean, really, I'm just scratching the surface. There's really so many things that PTs can do. I mean, even pelvic floor therapy after pregnancy or after having the surgery down there, um, can be really helpful to help people not be incontinent. So there's a lot. And even wound care, actually. Some PTs actually specialize in wound care. Now, we don't really do that here, but it's interesting. So, all right. The physical therapy myth number four is you need a doctor's referral to see a physical therapist. As a matter of fact, you do not need a referral to see a physical therapist. Um, in Ohio, I should say. So if you're listening to this and you're from a different state, you'll have to call the physical therapy office that you're interested in and find out what their state requirements are, because in Ohio, we don't. Now, what we do is that we'll do the evaluation and we will send over the documentation to your doctor, because we have nothing against your doctor. We want to work closely with your doctor. It just saves you a step, is what it comes down to. So, say you sprain your ankle, well, now you don't have to go to an orthopedic center, like a surgical center, or your family doctor to get in for physical therapy. They're trying to the um, reduce the barriers to receiving treatment, is what that comes down to. So there's no requirement in Ohio. If you hurt yourself or you're needing help with your balance or your strength, or you're having chronic pain and you'd like to help get some help dealing with that, um, then you just call our office and we'll try and get you in within 1 to 2 days. So yeah, that's good news. Good news for everyone. So now number five. The physical therapy myths you need to stop believing. Number five, once the pain is gone, PT is no longer needed. And so we do see this a lot. We have people that come in, they say, my knee hurts, I'm having trouble doing stairs, I'm having trouble walking, I'm having trouble doing lunges or getting up off the ground. So, a lot of times when people come in, one of the first questions we'll say is, we'll ask is your or how is your pain? How are you feeling today? Another question that I would rather ask and that I typically will try to ask is give me a win over the past few days that you've had. Tell me what things you're doing better, what things feel the same. Um, is there anything that you're not able to do, after what we did last session? Are you having more difficulty doing anything? So we're basically trying to get an idea of more than just pain, because pain relief is only one indicator of progress or of success. So while yes, pain is the thing that's keeping you from doing a lot of these things. Um, just because we resolve your pain does not mean that's the end of the ball game. It doesn't mean that you're automatically going to now be able to do stairs, because we need to figure out why you had this pain to begin with. Sometimes it was your job. You were sitting a lot and now you have weak hips, or all the different physical um, impairments, we call them, which would be like lack of flexibility, lack of strength, stiffness, numbness, tingling, all of those things. Those are all important details that if you're just looking at pain, it's really not going to tell you whether or not that person really is going to be able to meet their goals. And so, so say your pain is gone, but you're still having difficulty with the functional part of it. Well, then we're not done. You know, what about this? Say your pain is gone and you're able to walk and do stairs and you're able to do all the functional things, but you also continue to have the problems that caused you to have this pain to begin with. So say it truly was like really weak back muscles and your job, you're required to lift heavy things throughout the day. Well, if we don't address that strength, then you're going to be back here next week having the same issue. You might just be having a good week with pain. And who's to say that's not going to come right back? So what we can do in those cases is either um, we can give you something we can put you on hold and see, like continue to do some exercise. I want you to stay strong and continue to be active. Make these changes to your day-to-day life to reduce the likelihood of this happening again. So try and get up throughout the day, or try to get help with something that's heavier, things like that. We call it activity modulation, or modification. Um, and so, try that and then come back in 2 weeks. We'll see how you're feeling. If you're feeling better, then we can push it out. I want you to continue doing your things, and we'll see you in 4 weeks. Right. And then so, typically after 4 weeks, that's when I'll kind of say, that's fine. Just call us if you need us, kind of thing. But continue to do those things that we asked you to do, the things that you learned while you were here. Um, but a lot of times, if we didn't really address the core issue, the core problem, the reason you were having the pain to begin with, it's just going to come right back. And so we need to look at other things other than pain as indicators of progress or indicators of success. So like I said, strength, range of motion, flexibility, a tolerance to walking certain distances, tolerance to lifting heavy, certain weights of things that you might have to do in your day to day. But anyway, the goal is to keep the problem from returning. And so we do everything that we can to keep that from happening. We don't want your problem to come back the second you stop doing physical therapy. So hopefully that clears some things up. That is at least today, and I'll probably come back with more myths at some point, but those are five really common physical therapy myths that you need to stop believing, and that we as physical therapists need to get the message out there to educate and to just to get the awareness out there that that physical therapy can be so much more than just surgery or after surgery or after major injuries. So. All right, guys. Thank you for listening. And I know it's been like 3 to 4 weeks since the last episode, but I'm gonna keep on pumping these out and doing my best. It's tough when, we are trying to buy a house right now, trying to run the clinic, and also we have a 9-month-old and a 7-year-old, and so things get busy. But I do appreciate you tuning in, and we will get back on track here. Probably next week we'll do another episode. I have a couple of physicians lined up. We're just trying to figure out what's going to work for their schedules. So once again, this is Dr. Cameron Dennis. I'm a physical therapist with Back on Track Therapy and Wellness, and I appreciate you listening. Take care.